Welcome to another episode of Optometry Profits Revealed. I'm your host, Peter Precht. Today, I'm with Tony Sommer. Tony Sommer has had a 22-year career in eye care. He started off as an Air Force Academy veteran, and there's several different things that you've gone through. Rather than me diving through them, I think I'm just going to introduce you. Thank you so much for being here, Tony. Thanks for being here.
You bet, Peter, and thank you for having me.
I know, we'll start off with where you are now, and congratulations, you're the CEO and the CCO, recently promoted of Treehouse Eyes. Talk about the culmination of your journey getting there, but talk heavily about them right now, what your responsibilities are there, and how you guys function in the eye care environment.
Well, Treehouse Eyes is very mission focused on helping give children better vision for life. We are focused on, and no pun intended, on pediatric myopia management. And that covers a number of different products and therapies. We're agnostic on those. But we own 3 clinics where we see patients regularly. And we also have a large network of partners where we help them do their own myopia management programs, and we provide expertise, guiding, coaching, mentoring, accountability, and services to help them on their own myopia management journey. Our entire focus is on helping more children be seen. That's what we do.
Your work history is got quite a bit of myopia management themes throughout your time, and we know that at least we're able to see something impact the development of myopia. But at the younger ages, talk about that. How are we? You just mentioned the beginnings of this started in audio, which I found kind of interesting.
What I found interesting, if you think through myopia management, it started as kind of, I'll call it frontier science, right? Because we kind of don't know why we get myopic.
Right.
We know axial link's involved. So as you start thinking about how quickly can we spot this, you've got that dynamic. So you've got kind of indications, and then you've got products to treat it, but nobody's starting at the beginning, right? So what I came across is something called House Resolution 2527, and I came across it because of advocacy by the Myopia Collective and the American Optometric Association getting behind it. Now, what is House Resolution 2527? It provides a federal framework for vision screening and testing at a very early age. And why is that interesting? Because it is fashioned after a similar law that was passed in Congress, and very importantly had some budget around it and a regulatory framework for auditory. So as you do some more digging on this House Resolution 2527, you can find that auditory, maybe 3% of the children at the beginning of this century were screened for hearing, and 97% weren't. Well, now 25 years later, they had a similar piece of legislation and a framework that was set up, and now it's 97% of children are screened for auditory at a very early age, babies, right. And that way they can be treated if they have a problem. And it's not a bunch of money, because most people think, well, federal government brings money. It's not that. It is a framework and an environment that allows state and local governments to go ahead and build programs and have an anchor point, right? I'm not very much into government affairs. I'm not skilled at that. I'm a sales and marketing guy, but a myopia enthusiast, but right. Very exciting about that because it allows other people who do this thing to have that framework. And think about what will happen if we can do vision screening that early.
Well, the implication is unbelievable. To me, like you talked about axial length, I bet you we can find other reasons. I bet there's other, obviously the more you look at something, the other data you're going to find. I mean, that's,
Tons
to
of
me,
research.
that
Tons
right.
of research.
Yeah, so the opportunity is there to expand out in eye care in directions that we may not even be aware of at this point. And I think that's, to me, that's fascinating. Now, most of your career has been contact lens, and obviously we
Yes.
talk a lot about frames and lenses in this environment. But I want to talk about something specific because I'm fascinated with it. But I want to talk about monofit. We touched on it very briefly before we started recording. To talk about those experiences, and then talk about the SEMA lenses, and then your Visticons. You know, just like, what did you see? What you mentioned a lens a few minutes ago that ended up being ideal for another treatment, and it was a multifocal lens, and I don't remember the name of it. But
right. Yeah. So my own personal journey through vision care has been through manufacturing, right? The manufacturing side industry. I don't. I'm not a clinician myself. Never worked in an optometrist's office, um, and and I learned about contact lenses and just from being a user when I was very young, coming out of school. So when I started working in vision care, I had products for presbyopia, multifocals. I had no idea what they're for because I was not a presbyope at the time. It was I was much younger then. But I learned that ways to treat presbyopia were to do monovision, right? One near, one far. My father, that's how he was treated. A lot of patients that I knew were treated that way. That was kind of how you were taught to do it in soft contact lenses at that time. Fast forward, we had multifocals that we were trying to market. And the magic of multifocals was that you didn't have to do monovision, right?
right,
Um, and and the interesting thing, even with that, is that for contact lenses and presbyopia, for the most part, it is time consuming. It does not give the benefits that patients want because they're used to seeing perfectly or with their single vision contact lenses and they have crisp, effective vision. Well, you have a lot of trade offs with the multifocal, and even with monovision, you have an adjustment period. So, a lot of optometrists shy away from doing contact
right.
lens fits, and they'd rather do progressive spectacle lenses. It was more impactful. You had an entire infrastructure to help train and for the patient to adapt. They had potentially a better effect. I've never worn them. I've always worn contact lenses. So it, it was just that was what I learned, right, with monovision and monofits, to your point.
Right, right. And it, there's no question that there's a heck of a lot more flexibility. There's a lot of adjustability with a set of glasses. There's a lot. We bring them in and out and up and down. You don't have those kind of you know abilities with contact lenses. It's very finite. So you talked about those multiple visits. Those scenarios that aren't a good fit for whatever may be going on. I think of eons ago. This is when my oldest was born. I remember fitting a guy who was came in seeking a progressive lens, and the problem was that as I talked with the guy, he had neck surgery. He was wearing an executive. I mean, I was selling a nightmare back, problem back to myself. So, he ended up listening, and thankfully that it ended up going a way you know that was seamless and easy. But that's not fun. It's not fun to take somebody and curve them away from what they want, which is exactly what people are probably dealing with at that optometry seat. If an OD is dealing with a monofit, it's challenging. Or back and
Mm-hmm.
forth, or they may not know distances that they live in, work in, whatever may be the case.
Mm-hmm.
Tony,
Yeah.
I'm going to stop this crazy beeping for the cat feeder behind me, so this will get edited out. Hang on one second.
No worries.
Yeah, in action. Um, oh, so as we talk about that contact lens journey and how you've been through different places and how that's plugged into. What did you bring with you from that helped you get involved with a situation like Treehouse Eyes? Because that's, I don't know, that seems like such a dream situation to me. But probably it probably, you probably see uncomfortable things, but at the end of the day, you know there's answers coming, and it's not, has nothing to do with insurance. So talk about what you guys are. How does that work?
Okay, so for Treehouse Eyes, we are a global fee environment, and we don't accept insurance. So a parent brings their child in, um, and they've had education about the entire myopia management category, what to expect, what the visit's going to look like. They come in, it's an hour-long workout, and it is a comprehensive exam. And at the end of the journey, they enter generally a 2-year commitment with us because we set up follow-on and follow-up appointments. The doctors, the clinicians pick an initial therapeutic direction, and they go from there. Now, why do we do global fee? Global fee is simpler for our patients, and allows clinical freedom for our clinicians. So,
Okay.
Because the other thing is, if the child isn't responsive, and we're seeing them on their third month follow up,
Right.
the clinician can say, well, this isn't going where I want to go, or I need to do a combination therapy, and they just do it. So that's why we charge a global fee, because it allows for the clinician total freedom, and it is easier for the parents to understand.
That makes sense. The flexibility that you kind of need to be there. I know we're ping ponging around a little bit here. Back to myopia management. You had a post a week ago or something like that where you were kicking around. Oh, so should we make it billable? Should we not make it billable? I'm going to let you kick that one around. I don't know. I really don't know. I don't. I just don't know.
So I'm not an insurance guy. Don't know much about it, right? But what really piqued my interest in June was the American Medical Association. In their General Assembly, they had a resolution called 411 or 411, which I thought was interesting, right?
Yep.
For information.
Mm-hmm.
And they declared that myopia is a disease and should be treated as such.
Yep.
Right. So you've got the physicians saying it. Now, why was that interesting? So optometry pretty much has been the leader of myopia management, and probably will continue to be that place. There are more optometrists practicing myopia management, and a lot of the products are focused on optometrists. And ophthalmologists, they don't do that. Pediatricians don't treat it, et cetera, et cetera. But what this does is it sets up a chain of events that could eventually lead to reimbursement through medical insurance companies. Now, that's not going to happen next month. It's not going to happen next week. It's not even going to happen next year. There are a number of wickets that you have to go through in order to have CMS take it on, get codes set up, have funding by the federal government, adjudication on that, lots of commentary. The insurance companies have to take a look at it. There are tons of stakeholders and tons of moving parts in some of the world's largest bureaucracies, right? So this is not this is going to happen next year. But what I find fascinating is that though this is what I've always considered an optometry-owned thing, it's taking the physicians are now interested in it, right? Which opens tons of doors for screening of children and referral at that point. Because a pediatrician, if they're up to speed, motivated, educated about this latest idea of what's going on, might start talking about myopia with mom and dad, right? When they're bringing in their child, no matter what the age. And, you've all seen this. You've seen this in practice. You see this in clinic. You see this in the dispensary. Children holding on to a phone. Everybody's glued to a screen. Right.
Right.
So that's that's happening at a very young age now.
Yeah.
And so pediatricians will now start remarking on it, not just the optometrists or the opticians being the bad
there
guy.
You go.
If you think about it, right? Because how many times have you been in practice been asked, well, can you give them the talk about
You're right. You're right. Yeah.
You get to be the bad guy.
Yeah. Share some of that, schmutz. You deliver the bad news too. That's actually a good thing.
Yeah, and then referral comes from that, right? Well, you should go to so-and-so, another medical professional, and you should get this treated or looked at or what have you, and then it can enter the referral matrix and co-management. So yeah, I mean, it's a good thing. What category education is a good thing, and if category education is done by more people with authority, whether they're within the dispensary, the lane, or now in your pediatrician's office, that's a good thing, right? Because most parents don't know about myopia. They don't.
Well, that's exactly what my next question was. Like, what percentage of parents have a clue? And you're right. It's probably pretty low.
Some stats I've seen is 30% of our children have myopia, and less than 5% of them are in formalized treatment for it.
That's crazy. Or what's even more disturbing is to think that they could go and get it treated in a generic way and make it worse. I mean,
single vision, and there's so many factors that go into it. You got screen use, you got lack of outdoor time, you got a number of different things. You got genetics, which in the old days we thought it was just genetics, right? And then you can see the research from some of the earlier researchers,
right,
talking about, well, no, it's visual demand, lots of visual demand.
Which, again, what percentage of that is going to the pull, to the jump? Why? Like we were saying, we know how to connect a few dots. We still don't understand what the beginning of it is, and that seems bizarre to me that we've been doing this as long as we have. Not you and I, but the industry. And there's some pretty big holes there that maybe ought to make a little bit better sense than they do. To me, regarding the billing and the non-billing aspect of it, the fundamental non-component is that at the federal billable level, optician doesn't exist. So there becomes some problems there when it comes to implementation of products like any myopia management lens. Here's an ugly softball that neither of us have an answer to at all, that we mentioned before we were recording. Okay, somebody comes in and it's blatantly clear you're going to enter a myopia management program, and they want to order their glasses online.
Right now they won't be able to.
Right. But if enough of them want to, I don't have an answer for this, and hopefully right now that's easily remedied and built through, and I don't know the full ramifications of it. I really don't. I know that there are places where things can get billed and things cannot get billed, and the fact that 411 took place, to me, may open the door, as we're putting legislation together to become certified here, to actually acknowledge and put on paper that an optician exists, considering there's hundreds of millions of people that refer to their optician or themselves as one. So, it's a strange and mighty thing to think how political and insurance can weigh in on the terminology, which ultimately creates a billing code, which kind of answers the question for us. Obviously the optometrist has some vested interest in billing with this, but you hit on it earlier. If if all the errors keep pointing back to some practices that maybe they knew or not, it didn't help people down the road. Took little Bobby from a -4 to a -12 by the time he was 10. Okay, whoops, sorry. Well, again, how did this end up happening? If it's going to be billable, is the insurance going to be any better getting to the bottom of that? Nice long pause. I think we kind of know the answer to that one, or at least what we tend to think. Yeah.
Well, yeah, insurance helps with access, right? But insurance in and of itself is not care, and we know that,
Right. Right.
right?
Right.
The little card I
Right.
have in my pocket, or the group number that I give when I set up the appointment, does not guarantee care. It just helps you with access to the care. So I think you answered the question on whether it'll be any better. But for me, it really comes down to clinicians who are trained in this. Other countries, it's done by opticians, right?
Right. That's
Particularly in
true.
the United Kingdom and Italy.
Right. Yep.
So,
Yep. Those two.
Yep. So trained personnel who are committed to the craft, because this is a specialty. Right now, it's considered a niche, but it's not. I mean, it's all around us, and
Right.
you just need to educate the public so they know the questions to ask, and the fact that they need to seek professional help, and then enter the program and get it done. There's lots of ways to do this,
Which is probably the best part about it. The how there are a lot of ways to implement care, to take it into action, and a lot of different tools, that are at the
yes,
fingertips. That,
literally.
that yeah, that have been in use for a lot of years, and so it's not as if all techniques are bad. Things have been productive in helping curve, some of the problems with myopia getting so bad for someone so quickly. So let's talk a little bit. I asked you to kind of kick this around in your head before we started going about a tech experience over your time that was good and then maybe not so good. And then I'm going to kick off a new segment with you after that. So give us a thought. Give us a thought of a contact lens or a dispensary experience, whatever. Give us a tech that you think was a game changer and you loved it, and then maybe one that wasn't.
So we could go really old school and talk about what is usually a taboo topic, which is 1-800 contact lenses, right?
Okay, let's do it.
So that's a huge technological game changer, because it first used the phone, but it went online pretty rapidly when online became the thing. And tech experience, it's really good. It's got a great user interface. It's easy to use. It is seamless for you as a patient. I've had family members who've used it. I personally haven't, because I was in the industry. And it's wonderful if you're direct to consumer. The biggest issue, of course, is it's not the what, it's the how. And the how is what it really falls down on, because it becomes not as inclusive. You have other stakeholders like the optometrist,
right,
who needs to verify the prescription. And the way it was set up is that, it's automatically verified unless you proactively deny it. And
right.
that's the biggest rub, right? That was the biggest rub, because then you have revenue share and you have all sorts of issues and complications. So great technology that helps potentially a patient, but it may not help the patient because the patient has an old and expired prescription, so it's not the right prescription, and they haven't been evaluated by a trained professional. And then you've got channel shift as well, right? Business wise, both as an optometrist or the manufacturer. So it's one of those double-edged swords. Um,
Well,
other,
and
te- Go
patient
ahead.
convenience pushed it, but
Exactly.
there was those stupid holes. Like the things I remember being super annoyed about as an optician would be somebody who's seasonally new to order their year supply at 11 months and would only ever have a contact lens exam every 2 years after people blew a fit, you know, and they had it staggered just perfectly. I mean, they knew they were never gonna.
Yeah, and
They were
that's not
professional
non-compliant.
contact lens exam avoiders. I
Yeah,
don't know.
yeah,
I don't know what to
they're non.
call them, but
Yeah, they're non-compliant, and
mm-hmm,
getting an
mm-hmm,
eye exam is easy and efficient
right,
and effective, right? We just know we're all fans of that. So
right.
people who are dodging it as a lifestyle, I don't get that because you can't see.
Especially in the contact lens world, I just
Yeah, you can't
never could
see.
understand that at all.
You're not going to see as well, right? You've got an
Right,
old expired prescription. So yeah, so that was a bad one. Good and bad, but convenience drove it, not pricing, right? It
right,
is convenience, and
absolutely.
and that's where we're at now. And there's other ways of doing that that are more compliant. Um, so then the other technology story that I thought was interesting from this is Warby Parker. So think about it. Warby Parker started as a direct to consumer
Right,
play, um, and people loved it. They loved the style, they loved the lifestyle. It was really, really well marketed and produced good results, right? So I
right.
had several family members who got their Warby Parker lenses, and they called them Warby Parker glasses, right? So that was a
Right,
thing.
right.
But yeah, but you could tell that there was something missing from the business model because we talked about someone can adjust my Warby Parker glasses if I walk in at any shop, and some might and some might not on a matter of principle. I didn't dispense them to you, so I have no obligation. But
Right.
you could
Which was
you
an
could
unintended pain.
yeah, it's an unintended pain, right? But then
Right, right.
but then Warby Parker saw the benefits of having a physical presence,
There you go. And
right?
they did a little zigzag. They started off then heavy online and came back and tried to like change their leases because they did cut all those leases for a small window of time. I don't really understand what the philosophy of that was. Maybe they were thinking they could shift completely to online, but you are so right. They came back with a presence. And if you go to a mall, you can watch and watch particularly young girls where they'll look at all these frames online. They'll have three or four. They'll go in and try them all on and look in the mirror with them on. Put them back and go to the bed shop, the mall in order. And I just
Showrooming,
it's yeah, exactly. It's well it's
Best Buy.
but it's also right. Mod Pizza,
Yeah,
Subway.
yeah,
Well, you know that fits their lane. It's relatable. It's important to them, and let's go forward to where Warby Parker is involved in education in Indiana at the high school level. Okay, any other optical you want to be critical, but tell me you're doing that. Tell me that you're educating high schoolers in Indiana. Warby Parker is. They're part of it. Of course, do they have a vested interest of stopping remakes early in the process? Absolutely. And cultivating it within your own business structure is smart business. So if it ends up with a smarter optician, I don't care. That works for me and it will work for me every day. So I think that's really cool that you mentioned them because they fit in to some very unique places where they are disruptive and they don't care if they are.
yeah,
They
and that's just business, and I'm
right,
in I'm in the
right,
business of patient care. So for me, I mean, I get convenience, I get fashion, I get good marketing. I
right,
totally get it. For me,
right.
it's about patient care, right? So that's
Mm-hmm.
why I wasn't a fan of the 1-800 practices, when they started, and watching Warby Parker create a physical model with optometrists doing exams, right, in beautiful, beautiful retail settings. because I saw them in New York for the first time, and I was just amazed, and they're lovely. I'm like, oh, okay, we've gone full circle. We've gone from a direct-to-consumer internet grab to a more sustainable, I thought, a more sustainable patient care model, right? So, because
Well,
that's where I come down on.
I think it inevitably ends up reintroducing some elements that may not have been in that first segment of their retail journey.
Mm-hmm.
And again, these are all opportunities for education and existing optician groups to get involved. Um, Turn the page, meet patients where they want to meet.
Mm-hmm.
Uh, this is a great time to start off the new segment. I'm kicking off a new segment, and you kind of segue to it, so you may actually repeat yourself. But um, basically, the new segment is to tell an online eyewear ordering experience or story that you've heard of. You mentioned family. If you have any others, go ahead and lob one out there. Good, bad, great. It doesn't matter. I want there to be stories that are told because, quite frankly, they are talked about within the industry in an open format like we're going to do here.
Yeah, well, I mean, the one that so there was the convenience of 1-800 contacts, and that was a good experience. And my family was not non-compliant; they just needed more contact lenses, and
Right.
They
Right.
ordered them. They were wearing daily disposables, and they just worn too many, which is a great problem to have, right? That means they were very compliant. Um, for Warby, it was a lot of I get to try on all these frames virtually. I get to showroom this entire thing, and they got what they wanted, right?
Right.
When it comes to and it comes down to consumer satisfaction at that point, because that's if you haven't been seen for an exam and you're not sure what your prescription is, and you're not having an actual person line everything up,
Right.
then it's not really patient care. It's you're buying a thing, right? And then your thing, if you don't have the people that are trained to have it work properly, well, yeah, you're taking that risk. Didn't have that problem with my family, so they loved it. They loved the ordering experience. Everything was built around the consumer experience, just like any online business.
That to me, that is so telling. It built around the consumer experience. It, that I think is a part of the journey of getting glasses if you've never gotten them before. If you're 19 and you get a new prescription in your hand, and you don't have a vision plan, or you're not on your parents, or for whatever reason, but that's a what do you do? How is that handled? Who does what? How do I go about that in my life? And how things traditionally change, like you talked about, an ordering experience. The 1-800 experience changed that in a clunky, aggressive, ugly way because they were pre-internet. But
Mm-hmm.
the whole thrust of it didn't go away for the patients. And I like how you've sort of connected the convenient aspect of it with a succeed and a win on both ends, and regarding Warby Parker, it was a win to give life back to certain people that maybe have a little too much invested. While before we were recording, the young family with a kid, 2 eye exams on a Saturday, no. Of course they're going to want to do that in any other way that they can really do it. Get in, get out, get your script and go. They want their Saturday back. It's not that they want to buy so much less, it's that they want some of their life back. And, you're working 45 hours, you're raising a family, you're trying to make sure you're not going to, run out of everything. It's a challenge. So the convenient aspect of it, and like you talked about how gorgeous that the retail experience was that you went into with Warby Parker. Those
really
are
pretty.
Right. What a good combination. What an interesting way to meet the people's ability and want to shop this way, but still do this. When I was interviewing the Optical Jedi, Rick Peralta, he talked about how his daughter does that. She'll look here, do all of her homework here. I don't know if you're seeing that, or my children are in their 20s, and I do see that. They analytically analyze what they're going to do with their money, and then they're tangible with when they spend it. And I think that's a good thing. But we can't.
It goes to retail 101 though, right? I mean, which is I think the key to the commercial aspect of opticianry, which is I remember the first time I bought frames that I bought, to your point, right? So I have had to wear glasses for a long time, and I got most of my glasses in the military. They were literally handed to me in a bag. And it's like I had 4 pairs and they all looked the same. And luckily I was an aviator, so they weren't black frames. They were the silver frames. And to this day, I wear them. I wear those frames, and I just have the spectacle lenses redone because where I live, there aren't very many people who are Air Force veterans. So I don't look like a dork, right? So I wear them. But when I got to choose my own frames, what I loved was I got my eye exam, and the optician, I was given to her, and she looked at my face because I'm Hawaiian Chinese. I've got a round face. And she's like, we're going to go over here. Didn't ask me how much I was going to spend. We're going to go over here because these will look better on you. Right? And yeah, it was. She took me over there. I have no idea whether I overspent, but what I knew was this person took me and explained and showed me what she was looking at when she put them on me, right?
Yeah.
And it wasn't the bag of frames that I was handed, that I would get every
Right.
2 years, right?
Right.
As an aviator. So yeah, and that has stuck with me for all my life. And I choose frames based upon her recommendation 35 years ago.
Again, it's fascinating that you can have a single experience that wows you at any service level.
Yes.
You spend a fair amount of time on the road, so you understand the service components. And I used to say this all the time. There are places that I'll go where the service is outstanding and the food is
Yeah.
But I'm there for the conversation. I'm there for the way to watch seamless beauty in action, for lack of better terms. I mean, the food is as average as could be, but the people really flow in a way that is, when you see something run really smoothly like that, operations that are run like that, practices that are run like that.
Buc-ee's.
That's a really good example, actually, because they are crazy busy, and they're designed to get people in and out very, very quickly, and they do a good job of it. It's not sloppy either. They do it in a very, very direct way. But the production line part is encouraged in our industry, and you and I tend to want to slow this down at some level to make sure that care gets introduced to the right people at the right times.
Exactly. It's all
the
about
earlier
care.
that we can. Well, are there, that you're aware of, are there parts of legislation that are introducing? I know Pennsylvania is they just had something passed recently where that care goes very early into place. I don't think it had anything to do with 411, but maybe it did. But is there anything? Well, I tell you what. How about myopia being recognized at a federal level that you just mentioned earlier in this interview? I mean, the impacts of that have got to hit policy, I would think.
So that'll start that chain, right, with 411, and that's with the AMA making a stand. What's interesting to me, though, because my life for the last 12 years, 11 years, has been focused on category education about myopia with optometrists primarily and opticians overseas. And the key issue for it is that I always get this. Well, wouldn't it be great if my schools gave everybody a vision screening and referred them to optometrists automatically? Well, sure, that's great. So do you talk to the school nurses in your area and, offer vision screenings for all the children? Well, no. Okay. What are you going to do? Locus of control, because yes, that'd be great if they did that. And I've talked to, I was on the board of Global Myopia Awareness Council, GMAC, right? And we would talk to the National School Nurse Foundation and everything. And it's hard to get anything done on a broad scale. But this is where something like House Resolution 2527 can start that, because it gives the infrastructure, and then states and municipalities kind of know where to go if they want to get involved in that. And there's a little money, but not much, but they can tap and they can organize around that. And that's the big thing, because there's so many demands. But people always say, wouldn't it be great if this category education began? And that's where things like HR 2527 can do that. But every time I talk to my own clinicians, it's like, well, how do we get more referrals? Have we talked to the local pediatricians, right? And sometimes people push back, well, I don't know. I said, it's lunch with friends. It's coffee with friends. I'm in sales, right? So to me, it's like, oh, I'm just going to go visit you and we're going to talk and just educate, because to get a referral from a pediatrician is the gold standard, right?
All right.
Because normally they just say, "Oh, go see the ophthalmologist." Here's their information. Mm-hmm. But with this 411, it might become optometry, and that would be great. But start now. Start talking to other providers in your area about myopia as a disease. Here's the thing. Let's have some coffee and talk about it. By the way, this is what I do, right? So
there are oodles of regularly meeting networking groups that are connected with forums like Alignable and whatnot, as well as others. But they're constantly meeting multiple times a week at places, events, and anything. Sometimes it's just a regular lunch. I know there's one that's in York. I'm in Philly, so I never get to it. But it's good to know that they're meeting, and the diversity of people attending is kind of out there. I mean, the networking capabilities are quite genuine. The sooner that you can connect in with the next generation, that we know we have a myopia problem. We haven't eliminated it. Like we've talked about here, we don't even know where it comes from. But there's a management that's in place, and we're moving towards that. And we also know that it starts young. So
it starts young. Lots of
getting out there makes all the sense in the world. Being in their face so they know the signs, and yet it's one of those topics that's so gray for new parents. I don't, you don't want to be scaring, but by the same token, nobody wants to watch somebody go down that journey of being a mild myope to someone who couldn't get behind a wheel without glasses at all. So it's a topic that is continuously changing and moving in a direction I think is huge. Thank you for hitting on both aspects, the contact lens and the glasses aspect of the online ordering story, because they were both a direct impact to your world and your family. And I think that's kind of cool. That's a good way to start off that segment. Is there anything that we did not hit on that you specifically want to talk about? I'm amazed at the fact that Treehouse Eyes is able to be a self-standing on its own entity, which, when I say on its own, I mean not attached to policies and procedures that are going to be dictated by an insurance group.
Yeah, the whole thing about what I love about Treehouse Eyes is it's focused on category education in our local markets. And there's a lot of ways of doing that, right? But what I think is interesting for us is we don't think of new patient sourcing as one thing. We have an entire group of activities,
Right.
referrals,
Right.
right? Referrals is a
Yeah.
big one.
It
We
is.
do some local advertising, but not much. We do have SEO marketing on our website, and we've also bled over into AI, right? So if you type in myopia management wherever we are, we show up, right, into your AI bot. We also do category education so that, because we charge a global fee, so that parents aren't surprised, right? When a parent gets a message from school, like they're getting in the next couple weeks, depending where you are. Georgia, they started where I live. They
Right.
started school last week. So in a couple weeks, you'll start getting notes from school saying, your child, I had to move them closer to the whiteboard, right? You might want to get their eyes checked. That's
That's
usually how
cool.
people find out, right?
How about that?
So you'll find that out and you'll be like, oh, I have to go to the eye doctor. Well, I've gone to the eye doctor. I've got enter your vision plan here. So I'm expecting a $40 copay, some cute frames, and we're going to walk out, you know? But that's not the case for myopia management. It's a disease. It's a big
Right.
deal. We do a global
Right.
fee. So when they encounter us as a place they're going to go get treated, we have they call it telehealth, but we literally educate people on a Zoom call about this is what it is. Here's the experience you're going to have in our practice, and here's what you can expect to pay. Right. So they're completely informed, and then they come in and they go through the consultation. They get the therapeutic recommendation, and then they start the follow up. But they know that it's a program, much like braces. Right?
Right. Right.
We know what to expect with braces. I started saving for braces for my children the day they were born,
Right.
right?
Well,
Because we
and
know
chiropractic. Yeah, there's a lot of like times where you're
education.
on a program. Education was the next one I was going to hit on, and that's which makes the most sense. Obviously, as you're stepping along and progressing towards stuff, and physical therapy, chiropractic, all of those. There's a regimen moving you towards from A to B. You're heading towards a goal. Of hopefully better health, healing, range of motion, whatever your
But
goal may be.
that's what we do, right? We educate our prospective patient base on what to expect, and this is not unique to us. You just talked about chiropractic. I know about PT, same kind of thing, physical therapy. You have these expectations. You get educated about this. That is the biggest thing missing from myopia
Right.
management in this country. People don't know about it. And sometimes if all you did was read the stats, they'd get scared of it because
Well,
you're going to be blind at age 50 if you don't do something about it. Then they shut down.
well, exactly. And how much of us get data about things that we don't know that way?
And
We
yeah,
get
it's scary internet stuff.
exactly. And whatever the algorithm is going to scare you some more. Woohoo!
Yeah. So
Let's
come
get
on
on
in and
X
see
and
us.
get really scared on X. But
Yeah.
it's
Yeah. And
I
it's, yeah.
it,
But
it,
so I'm proud of us doing the category education and the
right,
intake. And for me, it's all about patient experience. You could tell from the way my family responded to the two examples I talked about. I really
right.
follow how people encounter our services and go through our treatment. It's very important to me because I want them to get what they want so they can get their Saturday back.
Well,
Right?
you ask difficult questions, and that's one of the things that really attracted me to you on LinkedIn is that you don't shy away from some topics that aren't really fuzzy and warm, and
Yeah.
how are things going to move past the gray areas, past the closed doors? How are we going to do that in an effective way to connect and bridge those gaps, build the bridges that are missing? We
And
always
nothing's
come back
fast.
to no, no. Well, even in Pennsylvania, we submit this legislation. 26. We don't expect anything to be implemented on the ground until well into 27, if it even passes.
Yeah, if it even
If
passes.
if there's restrictions and pushback, and there that could well be something that we face, then we seek who we can, we tell the stories that we can, and I think that we have a few heavy hitters, thankfully, in our lineup, so I think we're going to be fine. But building a legislative roadmap, that can be implemented in other places is what we're trying to do, and connecting that care to delivery rooms, as you and I have hit on, is, it's the natural extension of what we do. So moving in that direction, gathering data, finding things out we probably don't understand right now, and then changing our policies as we go. I think that's about everything that we're supposed to do in that care environment. And again, at least myopia care has shifted and moved towards it, which I think is wonderful compared to when certainly when I started, and certainly 25 some years ago when you began. Was there anything else that you wanted to add into this mix? I will add that I vicariously follow you, lived through your AT trail experiences. That I think it's completely awesome. I love that you document when you do it. I also like your follow-ups, when there's regular posts and then there aren't any, where there's those of us that are like, oh crap, is Tony okay? Did he pull a hammy and easy on a rock somewhere?
Well, I got a really good one from so I ran into a bear last Friday and posted.
Oh wow. You did, yeah, yes, so, you did.
Yeah,
that's cool.
And that was fun. So yeah, it's I love the Appalachian Trail. I love it because you can recharge, a walk in the woods, as they say. My friend Tom Arnold actually gave me that book. So yeah, it's a great place to go so you can think. We talked about that. And I love the social aspect of the trail because I hike alone, but you're never alone on the Appalachian Trail. You run into people that you're in their life for 5 minutes or 5 years. And
so cool.
I think it's amazing.
Well, there's definitely the trail stories, the human connections.
Yes.
With the AT trail, and the same with I forget the name of the one the out west, which is even longer. But
yeah,
that
PCT.
Yeah, I mean those stories are tremendous, and they're about people connecting, reconnecting, recharging. I have a friend that literally calls that whenever he organizes a guy's trip, it's recharging the batteries.
And the great thing about it, to your point, is you have you're not a role when you're out there. You're not a title. You're not your place in society. You are a nickname and how you show up at that moment, right? So if you show up with a lot of negative energy, people are going to avoid you and be like, goodbye, right? And now you're the jerk with the nickname. They don't know what you do, whether you're not the plumber that owns this very successful company. You're just a dude that's out there who happens to be really good at filtering water, right? So,
and the people there tend to know that too, and not all, but most of them have a pretty good grip that's a lot of why you're there. It's certainly about the overlooks and the beauty, but the reconnecting with the planet and the people in that way. When there aren't these, woohoo! We're doing something right. At least in my mind.
So I love it.
Absolutely. Thank you so much for this interview. I've been waiting a while to do this. This is very, very exciting, and to talk about how we can impact at an early age, how it can go through the journey that will take place before us that you and I are a part of is completely awesome.
Yes.
Any links to Treehouse Eyes, to you, Tony, will be in the show notes. By all means, participate in the Profit Prescription Quiz. It helps to talk about online experiences, ordering, and tools to remedy any leakage in the practice. Thank you so much, everybody, for another episode of Optometry Profits Revealed. Take care.